Could you please discuss idiopathic gastroparesis? I put this up here, which has not been mentioned in the course.
Mm.
And, I put this up here because that gastroparesis is basically the stomach muscles aren't doing their job, right? You're not getting that proper stomach emptying. So, we're talking about SIBO, we're talking about a lot of these related kind of chronic conditions that we're seeing in the gut, and these things are all related. So we've seen kind of this gastroparesis or this delayed emptying and improper movement of smooth muscle, and that is very much linked to neurologic function and can link to like omega-3 intake, can link back to your nutrition and what you're doing on a daily basis. So a lot of these things are connected, you guys, and stress will play into gastroparesis, especially when it's idiopathic, when maybe you've done a EGD, right, the upper endoscopy, and they're looking like everything looks fine. Your labs, looking at your papers,
idiopathic means I don't know, for
right.
those of you who aren't sure. Idiopathic means we don't know where it came from.
Right.
So hopefully your care team's able to help you identify where that gastroparesis came from. And then I'm sure your care team has recommended this to you, but if not yet, what I usually recommend for my gastroparesis patients are small, frequent meals. So that way you're not putting too much food into your slowly or non-moving gut at the same time. You'll probably do better with blended foods. So lots of blended soups, smoothies, nice creams, green juices, things like that. So that way there's less of that peristalsis needed to break apart, because part of when our stomach is churning and moving, part of it is it's breaking your food down a little bit for you. So if you're pre-broken down the food, you're making sure you're chewing it really well in your mouth so your saliva does its thing with its digestive enzymes. That's going to help reduce how uncomfortable you feel with gastroparesis. And you also might want to consider having ginger with every meal, or ginger capsules before each meal, or liquid ginger. Ginger is very helpful with upper GI motility. So it can help as kind of a spasmodic agent to help kind of encourage a little bit of movement there. But hopefully you're able to work with your care team and identify what's causing it, so it's no longer idiopathic and they know the cause of your gastroparesis.